Cancer is a common disease. Most of the time, it just happens by chance or because of a combination of lifestyle choices and environment. However, a small number of cancers are due to an inherited genetic change that in many cases can be identified through genetic testing. Genetic testing can be done with either a blood or saliva sample from you. The test provides three possible results: positive, negative, or uncertain. A positive result means that we found a change in one of your genes that we know increases your risk for cancer. Some changes have a greater risk for cancer than others. A negative result means that we did not find any changes that increase your risk for cancer in the genes that were tested. A variant of uncertain significance, or VUS, means that a change in one of your genes has been found, but we don't know if it increases your risk of cancer or is just a normal difference between people. Researchers are working on clarifying this. The benefits of identifying your inherited risk are improved prevention, early detection, and treatment of cancer. Your test results benefit not only you, but possibly your children, siblings, and other family members. The risks of genetic testing include the psychological impact of learning that you are at an increased risk for cancer and that this may affect other family members. There is a small chance that genetic testing will identify risks for other conditions that are not related to cancer. State and federal laws prohibit health insurance companies or employers from treating you differently based on the results of a genetic test. These include many state laws, as well as the Health Information Portability and Accountability Act, or HIPAA, the Americans with Disabilities Act, or ADA, and most importantly, the Genetic Information Non-Discrimination Act, or GINA. GINA does not cover members of the military, and it does not apply to life insurance, disability insurance, or long-term care insurance. Genetic testing may not explain a personal or family history of cancer, but that history is still important for understanding cancer risk. Your personal care is based on your genetic test results and family history. This information allows your provider to work with you to tailor a personal care plan for preventing, detecting, and treating cancer.
I would say the first and foremost thing is if you've either had cancer, find out if there is a role for genetic testing. Not everyone should be tested for genetics, but certainly if you've had a personal history of cancer, maybe, or if there's a strong family history of cancers in your family and you're not affected, maybe. But we're not here to teach people how to figure that out for themselves. Just have general awareness, situational awareness, and hopefully you're lucky to have a healthcare provider that has some knowledge of genetics. Even I have to say, I'm ashamed to say that many healthcare providers, especially the older ones that didn't learn this in medical school, have a hard time keeping up with this. I have a hard time keeping up with exploding information in genetics. So the point is we just need to keep getting the message out, awareness out, and just keep trying and trying and trying so that we don't see patients that come into my office maybe once every other week. Someone walks in the door where you look and say, oh my God, look at this family history, or they should have seen this coming. They didn't do genetic testing. We could have prevented this. So really what we're getting at with genetics isn't just to know or to find out about your genes, it's to be able to prevent cancers, not just explain why we got cancers. And not all cancers are caused by genetics, maybe 15, 20, 25% in the case of ovarian. So it's not a big piece of the pie, but it's a smaller piece of the pie that we can get a handle on. It's almost it is inexcusable. I won't even use the word almost. It is inexcusable for someone at risk that had a family history to end up with cancer and then find out after the fact they had a mutation and they could have been tested for it. That's inexcusable. Healthcare pays for it. Obamacare actually mandates that as part of preventive care for people with at-risk families. So there's very few excuses not to get this done. I think the main excuses are ignorance, both on the healthcare provider side and the patient side. And I don't mean ignorance in a derogatory way, just not knowing or not being aware. And we can make excuses about it, but I don't care. We just need to get over it. And whatever it takes, whether it's a movie, a lecture, newspaper article, another Angelina Jolie, whatever it takes, we need to get the message out. When you're watching football in October, you see pink everywhere, but there's nothing pink about ovarian cancer. It's not as prevalent as breast. Breast is 10 times more common than ovarian, but ovarian is twice as deadly. And for patients who have a BRCA mutation, breast cancer is only twice as prevalent. And so in the world of genetics, ovarian cancer is actually a more important gene in terms of its potency related to a genetic mutation. So it's important not to forget about ovarian cancer. And another reason people forget is they see a lot of breast cancer in the family. Many of the women have had their ovaries out preventatively, and someone always becomes the first one with ovarian cancer, and then they go, why didn't we think of that? So it isn't just about the breasts, it's also about the ovaries, but it isn't just about the ovaries either, and it isn't just about women either. There's an interesting fact with BRCA2 mutation, for instance, which isn't as powerful for breast, but men have a 9 times higher risk of prostate cancer, a more aggressive, more deadly form of prostate cancer with a BRCA2 mutation. So another common error is to always talk about the women, the breasts, the females in the family, and forget about the men that can also pass this along, can also have these mutations, can also get cancers. And I can rattle off more lists. Pancreatic is also part of BRCA. There's a thing called Lynch syndrome where there's a whole list of cancers. So genetic mutations can predispose to more than just breast and ovarian cancers. And so for the general population out there, if you're lucky, you'll have a healthcare provider that has the broader picture and doesn't just think about BRCA, doesn't just think about breasts, doesn't even just think about the breasts and ovaries, that looks at the whole picture.
We have partnered with leading diagnostic laboratories to offer providers and patients the most advanced techniques in analyzing hereditary cancers. These tests can help medical teams create the most efficient and effective personalized screening and treatment plans for their patients. Using this groundbreaking technology, a team of highly qualified professionals with specialized experience in genomics confidently offer customers efficient and accurate genetic testing results. Genetic testing looks for specific inherited mutations in a person's chromosomes, genes, or proteins. Mutations that are harmful may increase a person's chance or risk of developing a disease such as cancer. According to cancer.gov, inherited mutations are thought to play a role in about 5 to 10% of all cancers. If you are an individual who has a family or personal history of cancer and would like information on screening, please leave your contact information. Or if you are a healthcare provider or insurance agent who would like more information on how you can offer this potentially life-saving service to your customers, please provide your contact information and a knowledgeable customer service professional will call you.